Hello everyone, welcome to KNO Academy. So in this class, I am going to continue the MCQ discussion. Okay, MCQ session, that is the part 2. So part 1 we have already dealt with the high yield topics. Okay, high yield topics with the most advanced questions. Okay, so now also I have prepared very advanced questions. Okay, this is very helpful for the NORCET 9. Okay, and upcoming SCPGI. Okay, KGMU. Okay, and for RRB. Okay, so who are all preparing for NORCET 9, this is the most important class. Okay, please don't miss. Okay, so I am going with the first question. Drug of choice for the below cardiac arrhythmia is. So the drug of choice, which is the drug of choice? Okay, so we'll see options. Option A, injection amiodarone 300 mg bolus. Okay, injection epinephrine 1 mg every 3 to 5 minutes. Injection lidocaine 0.5 mg. Okay, then atropine 1 mg. So ECG questions are most favorite questions for the NORCET. Okay, so every NORCET 2 to 3 questions will be there. Okay, this is the most advanced question we have prepared. Okay, so even NORCET 8 they have asked one ECG. Okay, then ask them to calculate the heart rate. Okay, so image based question they have given one ECG. Okay, and ask you to calculate the heart rate. How to calculate the heart rate, that I will explain you. Okay, so here we will see big picture. Okay, so here we can see this RR intervals. Okay, so we have to calculate the RR heart rate. Okay, how to calculate the heart rate? So this is what abnormality we can see here is the bradycardia. Okay, so how to calculate this? I will show you. Okay, 300 by, okay, so boxes between the large box between the two RR interval. Okay, so 1, 2, 3, 4, 5. Okay, then 6. Okay, 300 by 6 is equal to 50. So here heart rate is 50. So we can consider this as a bradycardia. Okay, so we can consider this as a bradycardia. Okay, so I told you once again. Okay, once again one more picture is there. I will show you. Okay, so one. Okay, now number of box. Okay, number of boxes between the RR interval we have to calculate. Okay, then divided by, sorry, 300 divided by number of boxes we have to calculate. Okay, so which is the suitable drug for this cardiac arrhythmia is the injection atropine we have to give. Okay, injection atropine we have to give. This is the drug of choice for the bradycardia. And also atropine we are giving in the OP poisoning. Okay, OP poisoning also. Okay, and mushroom poisoning. Okay, so these are all the expected one. Okay, which is the antidote or which is the drug of choice in OP poisoning. Okay, they will ask you, and mushroom poisoning also antidote is the atropine. Okay, so amiodarone when we are giving. So amiodarone we are giving in the tachycardias and fibrillations. Okay, ventricular VT. Okay, and VF. Okay, epinephrine we are giving in the cardiac arrest. So during the cardiac arrest, we are giving injection epinephrine, that is the injection adrenaline. We are giving 1 mg every 3 to 5 minutes. Okay, and here lidocaine is the drug of choice in the myocardial infarction, MI. Okay, this is the drug of choice in the myocardial infarction. Okay, lidocaine we are giving. Okay, so now we'll understand the. Okay, here is the picture that shows the how to calculate the heart rate. So we can see here. See, this is the RR intervals. Okay, RR interval. So suppose ECG, if your ECG is like this, means one only 300. Okay, divided by 1 is so 300. So this is the 300 beats per minute heart rate. Okay, see here it has covered the two boxes. Two boxes it has covered. So that is the 300 by 2 is equal to 150. So here it has covered the three boxes. 3, 1, 2, 3. We have to calculate these boxes. Okay, these boxes. Then your heart rate will we can calculate. Okay, so next picture. So here also it's showing same how to calculate the heart rate by the small boxes. Okay, small boxes there will be 5 boxes will be there. Okay, so here what we have to do, 1500 divided by number of small boxes. See here we can see 1, 2, 3, 4, 5. Okay, so 5 is equal to 300. So here the heart rate is the 300. Okay, so here same 2 boxes means inside 5 plus 5. So total 10 will be there. So same 1500 divided by 10, that is the 150 beats per minute. So like this we have to calculate the ECG. So why I am showing this? Because NORCET 8 they have asked you to calculate the heart rate. So maybe this time they can ask you like this. So calculate the heart rate and which is the drug of choice for the ECG abnormalities. Okay. So hope you understand. So when you are giving amiodarone during the VT and VF, epinephrine during the cardiac arrest, and injection lidocaine during the MI. Okay, and injection atropine we are giving for this bradycardia. Okay, 1 mg. So 1 ampoule contains 1 mg. So and OP poisoning, which is a drug of choice, that is the atropine, and also for the mushroom poisoning we are giving the injection atropine. So we have to keep it in our mind. Okay, and we'll move on to the next question. Identify the below ECG pattern. Okay, identify the below ECG pattern. So this is also most expected question and most advanced question in the NORCET. Okay, so these many years they have asked only VT, okay, VF, okay, SVT, like this abnormalities they have asked. Okay, they are giving the abnormalities ECG and ask you to identify the given ECG, like that they have asking. So this is the one more advanced question. Okay, so options we can see sinus tachycardia, first degree heart block, and sinus bradycardia, normal ECG. So here this is not a normal ECG. This is not the sinus bradycardia. Okay, so RR interval is good. Okay, so we can calculate here. Okay, 1, 2, 3, 4. Okay, 300 divided by 4 is equal to 75. So this is not a sinus bradycardia. Okay, then first degree heart block. I will tell you. Okay, this is the right answer. This is not the sinus tachycardia. This is the first degree block. How we can calculate? Okay, so what how you are identifying the uh, heart block, first degree, second degree heart block. Okay, so now I am going to explain only the first degree heart block. So we have to see the PR intervals. Okay, so here we can see the prolonged PR interval is there. Prolonged PR interval we can see here. I will show you which is the PR interval. See, this is the P. Okay, so space between this P and R, this is the PR interval. Okay, so actually the time interval is the 0.12 to 0.2 seconds. Okay, is the time interval between the PR interval. Okay, and the small boxes will be around only 3 to 5 boxes should be there. So here we can see PR interval. So P, suppose P is starting here. Okay, from here to here, okay, it should be only 3 to 5 small boxes should be there. Okay, but here we can see more than 8 boxes. Okay, more than, see here 5 boxes plus here 3. So that is more than 5 boxes are there. So this is considered as a prolonged PR interval. Okay, so prolonged PR interval is seen in the first degree heart block. Okay, so this is the first degree heart block. So due to prolonged PR interval, how to calculate the, see I will show normal PR interval and prolonged PR interval here. See, this is the normal PR interval. See, we can see now, see this is only, see only 3 boxes are there. Okay, only I told you now 3 to 5 small boxes. Okay, 3 to 5 small boxes will be there in the normal PR interval. So that I already told you that 0.122, okay, 0.20 second, that is the 120 meter per second. Okay, so like this PR interval, so the space between here we can see this, from here to here is the PR interval. Okay, here to here is the PR interval, that should be, okay, 3 to 5 small boxes, and the 0.12 second is the normal. Okay, if it is extended, okay, if it is extended, is called the abnormal, that is the prolonged PR interval, it is seen in the first degree heart block. Next we'll move on to the next question, that is the refrigerated blood for more than 48 hours cannot transmit, this is the very important, cannot transmit the below disease condition. That is the option A is HIV, option B is the hepatitis B, and option C is the syphilis, and D is the gonorrhea. Okay, so here is the answer, that is the 48 hours. If we are, suppose if we keep the blood products, okay, blood products in the refrigerator, okay, refrigerator. So which disease cannot transmit? So the answer is the syphilis. I will tell you why. Okay, so here is the syphilis is the fragile organism. Okay, it's the fragile organism. It cannot survive outside the human body. Okay, only it is survived in the human body only. Okay, it won't survive in the fridge. Okay, in the refrigerator it won't survive. Okay, it will die immediately. Okay, that's why the syphilis will die immediately after the extraction from the human body. Okay, but in case of HIV will stay up to several weeks. Okay, HIV several weeks in the refrigerator. Okay, in the freezer. Okay, it will live up to several weeks. And hepatitis B, okay, it will live up to several months. Okay, and gonorrhea will be several days. Okay, this we have to keep in our mind. So syphilis will not survive in the refrigerator. Okay, so HIV, HBV and gonorrhea will transmit if suppose the blood products stored in the refrigerator. Okay, so hope you understood. This is the most advanced questions. Okay, and the next question is, which of the following ECG changes indicates in old MI? Okay, so old MI, after seeing that ECG, we can identify that this is the fresh MI or old MI, that is the myocardial infarction. Okay, myocardial infarction. This is the old or new, we can identify that. So option U wave and pathological Q wave. Okay, option C is the J-shaped wave and option D is the ST elevation. Okay, so here I will show you. Okay, so U wave will be identified in the U wave in the hypokalemia. Okay, U wave will be identified in the hypokalemia. Pathological Q wave. Okay, I will show how pathological Q wave will be. So Q wave, pathological Q wave will be it indicates the old MI. Okay, pathological Q wave indicates the old MI. J-shaped waves. Okay, J-shaped waves are Osborne wave we call. Okay, in during the NORCET 8 paper they asked Osborne waves. Okay, seen in. Okay, Osborne wave seen in or J-shaped. Okay, J-shaped wave seen in. Okay, hypothermia. Okay, and we all know ST elevation is seen in the hyperkalemia. So I will show you the all images. Okay, so pathological Q wave is present in the old MI. So suppose if you are taking the ECG, if you find that pathological Q wave, it indicates old MI. Okay, I will show you the old MI pathological Q wave. So this is the normal Q wave. Okay, this is the normal Q wave. So you can see that P after that. So this is the Q. Okay, there is no deep curve here, but here we can see there is a deep curve. Okay, so there is a deep curve. So that deep curve indicates the pathological Q wave. Okay, so this is the pathological Q wave deep curve. Okay, so this is the normal one and this is the abnormal one. Okay, so this indicates the old MI. Okay, and we will move on to the next. See, this is the U wave in the hypokalemia. Okay, this is the T wave. So here we have indicated this is the T wave and this is the U wave. Okay, U wave indicates that hypokalemia. Okay, T wave. Okay, ST elevation is indicating the hyperkalemia. Okay, so basic topics. Okay, then we'll move on to the Osborne or J wave. Okay, so this is also we can see here. So this is the J. See, this is the J point. See here we can see there is no curve here. Okay, just this is the J point. See here we can see this. So like this. Okay, so this is the J point like this. Curve is there, na? So that is the J point. So once again I will show you here. So this is the curve indicates that J wave, that is the Osborne wave, which is seen in the hypothermia. Okay, in hypothermia, we can see that Osborne wave or J-shaped wave. This question asked in the NORCET 8. Okay, so don't think that this already question asked in the NORCET 8. They will not ask in the NORCET 9. Question may be repeated. Okay, don't forget. Okay, instead of image based, they can ask you some other ways. Okay, we'll move on to the next question. Which of the following drug is not used in the management of unstable angina? Okay, we have to differentiate the stable and unstable angina. Okay, so which of the drug is not used? So this is the very important, not used. Okay, so we have to read the question very properly. So whenever you are attending the test or exam, okay, we have to use the question. Okay, you have to read the question 2 times. Okay, so option A, clopidogrel, enoxaparin, then streptokinase, and metoprolol. So we can see here the actually the answer is streptokinase. I will tell you how. Answer is streptokinase. We are not using in the unstable angina because it leads the bleeding. Okay, so actually the dual anticoagulants used in the unstable angina is the clopidogrel and enoxaparin we are using. Why we are using the metoprolol? Metoprolol is the beta blocker. Okay, it will reduce the workload of the heart. Okay, and oxygen demand. Reduce the heart workload, and it will working on the oxygen demand. Okay, and we are using the NTG also, NTG. Okay, NTG, what will happen? It decrease the same again oxygen demand. It will decrease the oxygen demand. Okay, and we can use the morphine also here. Okay, we are using morphine also, that will reduce the anxiety. Okay, so during the angina or MI, if any patient come, we are administering the oxygen. That is the first step. So we are administering the oxygen, but we are giving the morphine. It will reduce the anxiety and oxygen demand. So same even NTG also, it will reduce the this one oxygen demand. Okay, metoprolol, it will reduce the workload of the heart. Okay, so enoxaparin and clopidogrel. Okay, now this is the dual anticoagulant we call, which is given in the unstable angina. So the drug which is not given in the unstable angina is the streptokinase. Okay, and we'll move on to the next question. A 30 weeks of gestation woman comes with less than 7 gram per dl HB. Okay, what is the best management of this client? Okay, the blood transfusion. Okay, then PRBC, then injection iron sucrose, and daily 2 iron tablet. Okay, so we'll see. So as per the national guidelines, okay, anemia mukt bharat. Okay, so we can see here. Okay, suppose if it is less than 7 gram per dl. Okay, 7 gram per dl is considered as a severe anemia. Okay, so after 14th week, so we can administer IV iron sucrose. Okay, iron sucrose. This is the right answer. Okay, blood transfusion will be, suppose if the HB is less than 5 gram per dl. Okay, second trimester onwards, this is the very important. Second trimester onwards, we are giving the iron sucrose. In first trimester, we are not, as per the national protocol. So this image may be not clear. I will send you in the group. Okay, don't worry. Okay, in the second trimester onwards only, we are giving the transfusion or iron sucrose. Okay, so here the right answer is the injection iron sucrose. Okay, injection iron sucrose we are administering to this client. Okay, the best management is iron sucrose infusion. Okay, then we will move on to the next question. Which of the following anti-diabetes drug is associated with the deficiency of cobalamin? Is the vitamin B12? Vitamin B12 deficiency. Okay, this is very important advanced question and we can expect anything. Okay, see, the option A is the glimepiride, option B the metformin, and option C the liraglutide and acarbose. Okay, so the right answer is the metformin. Okay, right answer is the metformin. I will tell you. Okay, methylcobalamin deficiency is seen in the long-term use of metformin. Okay, metformin. Okay, and the most serious complication is the lactic acidosis. Okay, lactic acidosis is the most serious complication of the metformin tablet. Okay, and the most common side effects is the weight loss. Okay, weight loss is the most common side effect. Okay, most common complication is the lactic acidosis. Okay, so and also this is the vitamin B12 deficiency. We can see with the metformin. Okay, they have to check properly and go for the vitamin B12 supplements. Okay, then which is very important question. This is expected one. Okay, in the NORCET 9. Okay, which of the following electrolyte imbalance leads to the sign shown in the below picture? Okay, so everyone knows this process sign and the Chostak sign. Okay, so Chostak and process sign. This is the Chostak sign. This is the process sign. Okay, I will tell you. Okay, so the options are hypokalemia, then option B is the hypoglycemia, then option C is the hypomagnesemia, and option D is the hyponatremia. There is no option hypocalcemia. These two are the signs of the hypocalcemia, but here there is no option of the hypocalcemia. Then which is the right answer? So hypomagnesemia is the right answer. I will tell you, hypomagnesemia leads to the hypocalcemia. Okay, hypomagnesemia leads to the hypocalcemia, then it leads to the Chaustuck sign and the Trossis sign. Okay, so the normal hypomagnesemia level is the 1.5 to 2.5. Okay, normal magnesium level. Okay, we have to keep it in our mind. So what are the causes of hypomagnesemia? Is the chronic alcoholic. Okay, then diuretics usage. Okay, then malnourishment. Okay, so these are the causes of hypomagnesemia. It leads to the hypocalcemia. Okay, Chaustock's, this is the Chaustock sign and this is the Trossi sign. How we are going to assess this? Okay, so we have to tap on the angle of the. Okay, we have to tap on the angle of the jaw. Okay, here, so we have to tap like this. So muscle twitching is seen in the, so that is the we are assessing the facial nerve. So muscle twitching seen, okay na, on the assessing site. So that is called the Chaustock sign. And here Trossis sign is the we have to inflate the BP cup. Okay, we have to inflate the BP cup and we have to inflate more than systolic pressure. Okay, when we are inflating more than systolic pressure, so we can see this the carpopedal spasm like this. Carpopedal spasm like this. Okay, so that is called the process sign. Okay, so these two are the classical signs of the hypocalcemia. Okay, hypocalcemia. Okay, so hope you understood. Then we'll move on to the next question. Who are the beneficiary? Okay, beneficiaries under the weekly iron and folic acid supplements program. Okay, who are the beneficiaries? Okay, option A is the adolescents age between 10 to 19 years, and pregnant women between the 20 to 40 year, and lactating women between the 20 to 40 year, and adolescents, pregnant and lactating women. Okay, so we can see that WIFS. Okay, weekly iron and folic acid supplements we are giving to the option A is the right. Okay, adolescent age between 10 to 19 years. Okay, this is the program. Okay, so what we are giving here means that is the 100 mg of elemental iron. Okay, plus 500 mcg of folic acid. This is the dosage we are giving. So up to 52 weeks is the up to 52 weeks we are giving. So under this program, we are screening also happening. Okay, screening of iris cases, and also referral will be there. And also very important, biannual, okay, deworming. Biannual deworming. Okay, so this question two times asked in the NORCET 8. Okay, NORCET 8. Two questions asked in the same. So when we are celebrating the National Deworming Day, so actually we are celebrating annually, biannually. That is the yearly two times we are conducting. Okay, that is the February 10th and the August 10th. So don't forget the dates. February 10th and the August 10th we are okay conducting the National Deworming Days. Okay. So and here this adolescents, pregnant women, and lactating women are comes under with the ICDS program, not with the WIFS. Okay. So WIFS program is supplementation of iron and folic acid tablet, that is the 100 mg of elemental iron plus 500 mcg of the folic acid. So this is given to the 10 to 19 years of the child. Okay, and that is up to 52 weeks we are giving. Okay, and also we are included in biannual deworming days, also included in the WIFS program. Okay, hope you understood. Then question number 31. So which of the following contraceptive method cannot be given at the doorstep of delivery? Doorstep delivery we are not giving to the beneficiary. So which of the following IUDs? Okay, the right answer is IUDs. Okay, so very simple question only, but this is the most advanced and most expected question for the NORCET. So levonorgestrel, yes, we are giving. Okay, we can give ASHA. Okay, this is given by the ASHA, and also centroman, that is called Chaya. Okay, don't confuse the name. Centroman is also known as the Chaya and oral contraceptive. We are giving to the doorstep. Okay, so and also what others can be given other doorstep is the condom. Okay, and EG pills. Okay, EG pills also we are giving. Okay, that IUD, that is the IUCD. Okay, which is not should be given in the pH level or MCH. Okay, so this needs a high trained, okay, high trained personnel only can administer or can insert the IUCDs. Okay, the trained person only can insert the IUCDs with the sterile technique. Okay, so if we are doing with the unsterile practices or aseptic, not if you are not following the aseptic practices, it may lead to the PID, okay, and complications. Okay, it should be always is a sterile procedure under the supervision we have to insert. Okay, so this is not the doorstep. So this is under these are all the most advanced question. Okay, they may ask okay in the NORCET and RRB. Okay, CPJ also. Okay, and the next question is the clinical features of hyponatremia. Hyponatremia includes all except, means all under the all are the features of the hyponatremia, but one is not the feature of hyponatremia. So which is that we will see here. muscle weakness, seizures, extreme thirst, and the decreased urinary specific gravity. So right answer is the extreme thirst. Okay, hyponatremia. Okay, hyponatremia means so. Okay, salt levels are less. Okay, more water will be there. Okay, in the blood. Okay, so extreme thirst is not a sign of hyponatremia. It is the sign of hypernatremia. So normal sodium level is 1 more than so 145 milli AQ per liter. So what is the 140 to 145? Okay, that is the normal range. Suppose if it is less than 140, we'll call it as a hyponatremia. If it is more than 145, that is the hypernatremia. During the hypernatremia, okay, water level will be less, salt level will be okay. That's why we can see the dry mouth. Okay, so dry mouth will be there. Okay, dry mucous membrane, decreased urine output. So this is the I'm telling the features of hypernatremia. So decreased urine output. Okay, we can see the decreased urine output and lethargy. Okay, permanent. Most complication is the permanent. Okay, brain damage seen in the uh, hypernatremia. Okay, the features of hyponatremia is the seizures will be there. Okay, most complicated one is the seizures. Okay, that is the confusion, seizures. Okay, muscle spasm will be there. Okay, weakness will be there. Decreased urine specific gravity. Okay, this is a very important. Okay, I will tell you what is the urine specific gravity. So urine specific gravity is the okay. What is the dissolved particles in the okay, that is the amount of particles. Okay, amount of particle, that is the salts, urea, and okay, anything. Okay, in the urine. Suppose the most diluted, the decreased specific gravity urine contains the most diluted urine. Okay, most diluted urine means water level will be high in the diluted, so salts will be very less. But in case of increased specific gravity means, okay, this is the undiluted and very concentrated urine you will get. Concentrated urine we'll see in the increased specific gravity. What is the normal specific gravity? Is the 1.0052 to 1.030 is the normal specific gravity of the urine. Okay, don't forget, this is the basic question. They may ask you in the upcoming exams. Okay, so normal specific gravity is 1.005 to 1.030. Okay, so less easily I will tell you less. Okay, decreased urine specific gravity means more water will be there. Okay, increased water specific gravity means increased means more salts will be added, and decreased means more water is added. So diluted and the concentrated. Okay, so hope you understood. Okay. So in the hyponatremia, we will see with the same, okay, decreased urine specific gravity because the water level is more, and the seizures will be there, muscle weakness will be there. In case of hypernatremia, okay, extreme thirst will be there, a dry mouth will be there, urine specific gravity will be increased. Okay, these are the opposite complications. Okay, and what is the treatment we can see here? Okay, suppose for the hyponatremia, we are giving 3% NS. Okay, 3% NS infusion we are giving, and also soda mint tablets. Okay, we are giving the soda mint tablets and the 3% NS we can administer. And what is the treatment for hypernatremia? Hypernatremia treatment is the free water. Suppose if the patient is on ventilator, okay, on raised tube, okay, what we are giving? We are giving the free water, 200 ml second hourly we can give. Okay, so dilute the salts. Okay, so free water, and also we have to assess the urine output also, and we have to measure the specific gravity. Okay, free water is very important. Okay, H2O, and also fluid. So drug fluid choice is the half NS. That is the Half NS is the fluid of choice in the hypernatremia. Okay, half NS means point. See, normal saline, this one concentration is the 0.9 percentage NS. Okay, this is the normal. Half NS means, okay, that is the 0.45 percentage. That's half NS is the fluid choice in the hyponatremia. Hyponatremia, we cannot give the 0.9% also, we can give only 0.44 percentage. Okay, in case of hypernatremia, okay, because sodium level is high, but here during the hypo we can give the 3% NS. Hypo means we have to increase the sodium level, that's why we are giving 3%. Okay, so for the hypo 3% NS, for hyper we are giving the 0.45, that is the half NS. Treatment of choice is the half NS, and also free water. The next question, what is the targeted pre-ductal SpO2? Pre-ductal SpO2 after 10 minutes of birth. Okay, so we have to look into this very. What is the? There are two stages are there. One is the pre-ductal and the post-ductal. So this is that's why I'm telling these are the most advanced questions we can expect in the upcoming questions, upcoming exams. Okay, so pre-ductal and post-ductal. So in pre-ductal, so after 10 minutes of birth, which of the following is the expected or targeted saturation is the 85 to 95. Okay, so I will show you the chart. So what is the pre-ductal and post-ductal? I will explain you. Okay, this is the chart, that is the pre-ductal, targeted pre-ductal chart. Okay, 1 minute is the 60 to 65 percentage is normal, and 2 minutes that is the 65 to 75%, and after 3 minutes that is 70 to 75%. In the fourth minute that is 75 to 80%, and in the fifth minute that is the 80 to 85 percentage, and 10 minute that is the 85 to 95 percentage. This is the pre-ductal SpO2. So what is the pre-ductal? Is the before the ductus arteriosus. Okay, so the blood reaches the before ductus arteriosus, that is called the pre-ductal stage. So pre-ductal SpO2 is assessed in the right hand. Okay, post-ductal SpO2 is assessed in the limbs, that is the foot. Okay, we can assess the post-ductal SpO2 in the foots and the pre-ductal in the right hand. Post-ductal means that already blood crosses the ductus arteriosus. Blood passes through the ductus. Post is the already it has crossed the ductus arteriosus. Okay, so suppose if the ductus arteriosus not closed means that is called patent ductus arteriosus. Patent duct PDA we call PDA. So that is a big chapter. Okay, we will deal with the, so Akhil sir will deal that. Okay, PDA. Okay, so just you imagine pre-ductal means before patent. Okay, now before ductus arteriosus, and post ductus means after the post ductal passage of the blood. Okay, so pre-ductal is assessed in the right hand and the post-ductal is assessed in the foot. Okay, this is the advanced question. Okay, they may ask you. And the next question is, consider the following vaccine given to the children. Okay, and arrange them as per the immunization schedule. So as per the immunization schedule, which are the vaccine is come first? So we have to arrange, that's all. Okay, this is a very simple question, but so we can expect like these questions in the upcoming exams. Okay, so option one is, okay, MR2 vitamin A second dose, and second DPT booster, and third dose of rota vaccine, and the PCV booster. So as per immunization schedule we have to arrange which is comes first. Okay, the option A is the right answer. I will tell you how. 4, so this is the 1, 2, then this is the 3. Okay, this is the 4, This is the 5. Okay, I will tell you. So first one is the MR. Okay, MR is given at the age of 16 to 24 months. Okay, 16 to 24 months. And then vitamin A is given in the 15th month. Okay, and DPT booster is the 5 to 6 years of age. And third rotavirus vaccine so is given 14 weeks. Okay, and PCV booster, that is the pneumococcal conjugate, is given in the ninth month of age, 9 months. Okay, so based on the age group we are assessing. So first one will be, so this is the 14th week, so this will come first, and second is the PCV. Okay, and third one is the vitamin A, and fourth one is the MR2, fifth one is the second DPT booster, that is the 5 to 6 year of age we are giving. Okay, and the next question is the dilutional fluid of BCG vaccine. This is the favorite question. Okay, definitely question will come. Okay, so which is the fluid we are using for the, or solution we are using for the dilution of BCG vaccine? So BCG will come in the, it is a freezed dried powder. Okay, so this is a live, okay, live vaccine. Okay, so we can read here. So what is uh, extension of BCG is the, that is the Bacillus, okay, calmette guerin. Okay, this is the Bacillus calmette guerin. So these two are the, they are the scientists. Okay, Albert Calmette and the Camille Guerin. So these two are the scientists who invented the BCG vaccine. Okay, so BCG vaccine is extracted from the, okay, weakened weakened strain of the Mycobacterium bovis. Okay, so okay, this is the weakened strain of the Mycobacterium bovis. Okay, the solution is the option. Okay, we can see here ringer lactate, normal saline, and the dextrose 5% on the sterile water. So ringer lactate we never use for the dilution of any vaccine, and also dextrose also we are not using for the dilution of any vaccine. Okay, so here the right answer is option B, normal saline. So normal saline only we are using for the BCG vaccine dilution. Okay, so the time period, that is the when, so how long we can use the diluted BCG vaccine is the only up to 4 hours. Up to 4 hours we can use the diluted BCG vaccine. After that we cannot use that. So and one more thing, the open vial policy. Open vial policy is not applicable in the BCG. Okay, so open vial policy means some vaccines we can keep, after opening we can keep for some days. So that is not applicable in the BCG vaccination. Okay, so this is regarding the BCG vaccination. Okay, and the option is B. Okay, and sterile water for we are using for the measles vaccine. Okay, for the measles vaccine dilution, we are using the sterile water, but for the BCG vaccine, we are using the normal saline. Keep it in your mind. Okay, so I'm just explaining the expansion of the BCG. Okay, and the this is the live vaccine. Okay, open vial policy and up to 4 hours. These are all the important points. Okay, key points. You have to keep it in your mind. And we'll move to the next question, that is the benefits of OCP includes all except, okay, so oral contraceptive pills, that is the benefits. We can see that protection from the ectopic pregnancy, okay, protection against the ovarian cancer, protection against the endometrial cancer, and protection from the breast cancer. So these are the four options. So here we can see one by one, that is the protection from the ectopic pregnancy. There is no pregnancy, how the ectopic pregnancy will happen? So this is impossible. Ectopic pregnancy is impossible. And protection against the ovarian cancer, yes, this is okay. This is okay. Yeah, this is there. So ectopic pregnancy is not possible. That's why it is protection. Okay, and also protection against the ovarian cancer. Yes. Okay. and protection against the endometrial cancer. Yes, this is also studies have proved. And protection from the breast cancer. Okay, some people think that it is also protection for the breast cancer. No, this is not the protect against the breast cancer. Okay, many studies proven that long term usage of breast this one OCPs causes the breast cancer. Okay, so should not use the long time. Okay, so this is the right answer, protection from the breast cancer. This is the except, so the right answer is protection from the breast cancer. Then question number 37, most freeze sensitive vaccine is the most freeze sensitive vaccine is the, so here we can see the option OPV, pentavalent vaccine, PCV and the hepatitis B. Okay, these are the four options. Here we can see that hepatitis B is the most cold or freeze sensitive, okay, or cold sensitive we can call. So heat sensitive and cold sensitive. Okay, so heat sensitive is always OPV. Cold sensitive is the hepatitis B vaccine. Okay, so here one diagram I will show you. So this is a diagram. So from most to, okay, least. Okay, most sensitive to least sensitive. So here we can see that, see, sensitive means should not keep outside the, see, heat sensitive means we should not keep outside the fridge. Cold sensitive means we should not keep it in the freezer, or deep freezing we should not keep. So that is the sensitive means sensitive to the cold is cold sensitive, and sensitive to the hot is the heat sensitive. Okay. So here see, sensitive to heat. Okay. It is unstable in the heat. Okay. That's why OPV we cannot keep it outside. Okay. OPV, first one is the OPV, and measles, DTP, yellow fever, okay, BCG, and Hib vaccine, and DT tetanus. These are all the most most sensitive to least sensitive. Okay, we'll come to the sensitive to cold. That is the hepatitis B will come in the first. Okay, Hib vaccine, DTP, TT. Okay, these are all the least sensitive. Okay, we'll move on to the next slide. So question number 38, that is the site of the apical pulse in the children. Okay, so this is the most expected question. Site of the apical pulse in the, means where we are auscultate the apical pulse in the children. That's all. Okay, the option A is the fifth intercostal left midclavicular line. Okay, and the option B is the fourth intercostal right midclavicular line, and fifth ICS right midclavicular line, and the fourth okay, intercostal space left midclavicular. Okay, the option is the fourth intercostal space left midclavicular line is the, okay, apical pulse space for the children. And here option A, okay, fifth intercostal space left midclavicular line is the adults. Apical pulse is auscultate the heart rate. Okay, we are keeping the step on the apex of the heart. Okay, we are counting the heart. So when we are assessing this apical pulse, okay, means to identify the pulse deficit. So what is pulse deficit? Okay, so this is the difference between the apical pulse, okay, apical pulse minus, okay, radial pulse or peripheral. Okay, so this is the difference between the these two pulse. Okay, heart rate and the peripheral pulse. Okay, so here we need in the same particular time we need two persons to calculate this. Okay, so whenever we are administering the digoxin, okay, digoxin, so we can check this. Okay, we are checking the pulse deficit during the digoxin administration. Okay, to calculate the apical pulse and radial pulse. Okay, so what it show means it shows the heart failure. Suppose if any deficit in the pulse, okay, so high deficit is the, okay, classical the sign of the heart failure. Okay, and we'll move on to the next question. which of the anticoagulant used in the green tube vector? So I have inserted the image. Okay, for the green tube vector, even last class also I have explained. Okay, which of the anticoagulant is used in the green tube vector? So that is the sodium fluoride, or sodium citrate, EDTA, or heparin. So these are all the anticoagulants, but in the green tube, which anticoagulant is used? So this is the heparin tube. Okay, heparin tube we are using for the property. Okay, so I will show you one image. So here we can see this. Okay, this is the SST gel. Okay, serum separator gel. This is the green is the heparin. Okay, and this is the fluoride. This is the gray color one. Okay, so this is the black. ESR tube is the black one. This is the gray one. Okay, and this is the EDTA. This is the plain, no additives. Okay, this is the sodium citrate. Okay, this we are using for the PTI and APTT here. Okay, heparin is for the trophy, chromosomal studies. Okay, amino acids, lead, everything. Okay, this gel, okay, na, this we are using for the all biochemistry. Okay, for the serum. This also we are using for, say, suppose if that is not available, we can use this. Okay, so we'll move on to the next question. What is the storage temperature of the platelets components of the blood? Okay, storage temperature. Okay, at which degree temperature we can store the platelets? Okay, so option A is the 18 to 20 degrees Celsius. Okay, 15 to 18 degrees Celsius, 22 to 24 degrees Celsius, and 24 to 28 degrees Celsius. So the option C is the right. That is the 22 to 24 degrees Celsius we can store the platelets. So maximum up to 5 days we can store. Up to 5 days we can store. So, and what is the PRBC? PRBC we can store in the plus 2 to, okay, plus 6 degrees Celsius. Okay, this is the PRBC storage. And FFP we can store, okay, minus 30 degree. Okay, this up to, okay, 1 year we can store. Okay, and cryo precipitate, this is also minus 30 degrees Celsius. 30 degrees Celsius up to 1 year. Okay, so this is the storage for the blood products. And the last question is the orthostatic hypotension. Okay, so which one we call the orthostatic hypotension? Option A is the SBP. Okay, SBP reduction in more than 20 mmHg and DBP reduction in more than 10 mmHg within 3 minutes of standing. Option A. Option B is the SBP and DBP reduction in more than 10 mmHg within 3 minutes of standing, and SBP reduction in more than 10 mmHg and DBP reduction in more than 20 mmHg in 3 minutes of standing. And option D is the SBP and DBP reduction in more than 20 mm of Hg within 3 minutes of standing. So here we can see, okay, so the option A is the right answer. So whenever person lying down, okay, suppose a person is lying down, okay, his, his BP, so okay, after standing, okay, within 3 minutes only we have to check the BP. Suppose his BP is 120 by 80. When sleeping, lying on the bed, we checking the BP, that is a 120 by 80. Okay, that person stand. Okay, orthostatic means person has to stand. Okay, then we are checking the BP within 3 minutes. Okay, in that, suppose SBP is, okay, reduction in the 20 mmHg and DBP will be 10 mmHg. Okay, so roughly we can say that 100 by 70. If it is comes, that is the what is called orthostatic hypotension. So why orthostatic hypotension will happen means, so when a person, so see, blood is blood is like a water. Okay, blood is like a water, so it will like a hydrostatic pressure. Okay, it will move whenever we sleep, it will, okay, flows. Okay, when we stand, okay, so the unable to pump the from the lower extremities. Okay, from lower extremities blood will not come up. So orthostatic means patient will stand, so blood will move immediately down. Okay, so whenever hypovolemia happens in the during the hypovolemia, okay, so we are giving that, which here, okay, during the hypovolemia, We are giving head and head down elevation. We are keeping the foot end elevation. Okay, foots are high, head is down. Why? To maintain the blood level. Okay, na? To maintain the, to keep the brain normal. Okay, na? To supply the brain to the blood to the vital organs called brain. So to the circulation of blood. Okay, so up to 6 minutes. Okay, na 4 to 6 minutes. Within 4 to 6 minutes, suppose stoppage. Okay, na blood circulation stopped to the brain means so brain dead will happen. Okay, to prevent that, we are giving the foot end elevation and head down. We are keeping head down. Why? So I told you, blood is like a water. Okay, suppose if you are giving foot end elevation, all okay na the blood okay na, in the limbs are coming up. Okay, so for that reason only we are giving a foot end elevation. So this is so orthostatic means when the person stand within 3 minutes of time, we have to check the BP. If it is come SBP less than 20 and DBP less than 10 is called the orthostatic hypotension. This is the most advanced question. Okay, so this by this we are going to finish this session. If you have any doubts, okay, you can ask us. Okay, you can comment in the comment section also. Okay, for the app users, you can ask in the WhatsApp group. Okay, and also you can comment that which topics you want to means suppose many candidates having the doubts, okay, regarding which is the high. Actually we are already released the high yield topics, in our WhatsApp group. Okay, suppose still if you have any doubts, okay, which are the topics are essential and which are the topics you have not understood, so we can ask in the comment and also you can ask in the WhatsApp group. So we will take the next session. Okay, so don't worry, within August 31st, so we will finish all your high yield topics in the app. Okay, okay, thank you all.